After identifying the problems and assessing the potential barriers involved, the next step in the knowledge to action cycle is to select, tailor, and implement interventions. As new graduates, we have developed a resource which we hope will aid nurses in communicating effectively with patients who have communication difficulties following a stroke. As mentioned previously, our resource is targeted towards nurses due to their frequent interaction and care they provide the patients. Therefore, as speech pathologists, it is our duty to ensure they are equipped with the tools and strategies for effective communication. This resource is called Communicating Basic Needs, a training package for nurses. It comes in the form of a package and is given to each nurse working in the stroke unit. It includes a pictographic communication board, a training DVD, a bed sign that states, "I need help communicating," and 2 evaluative questionnaire forms. The communication board is an aphasia-friendly pictographic tool. We have designed this communication board solely for the patient to communicate his or her basic wants and needs in the early stages of the stroke. Supported conversation techniques have been chosen as our main intervention with this resource. Firstly, it is important that health professionals acknowledge and reveal the competence of people with aphasia in the early stages. We can do this by helping them get the message in, giving them an opportunity to get the message out, and lastly, by verifying the message. Secondly, studies have shown that pictographic resources are effective when communicating with patients with communication difficulties. With this in mind, we have created a communication board. The idea of this communication board is so that patients are able to point to the pictures in order to communicate. We have used a white background and simple images which are grouped according to hygiene, meals, personal items, people involved in care, physical comfort, temperature, and emotion. The images are spaced out to ensure that the patient is not overwhelmed or confused by the sight of the communication board. The images are supported with large bolded text for clarity. The yes and no images will assist the patient with generating a reliable yes or no response. There is also a picture that suggests confusion, which the patient may point to when he or she is confused or does not understand. As new graduates, we suggest that nurses verify their understanding with the patient by communicating verbally while pointing to the images. With the use of the communication board, patients should be able to communicate their wants and needs effectively, even in the early stages of their journey to recovery. We have developed a short training DVD specifically tailored towards nurses working in the neurology ward in the acute setting. The before and after videos provide the audience with a contrasting view of communication without versus communication with the communication board. While supported conversation techniques are not taught formally, the use of the communication board was designed with supported conversation techniques in mind. The before video provides nurses with an opportunity to identify communication breakdowns and barriers without any tools or strategies in place. In the after video, the nurse uses the communication board as a tool to acknowledge and reveal competence, as well as to verify understanding. It also provides viewers with an idea of how direct communication can result from the use of this communication board. The training DVD will provide nurses with a model of how we intend the communication board to be used and hopefully motivate nurses to adopt the implementation of the communication board. As new graduates, we understand that nurses are extremely time-poor professionals, which is why we have ensured that the DVD is very short. It is our advice that nurses are allocated a specific time slot during their day to watch the training DVD to ensure full participation. Observing a speech pathologist using a communication board with the patient may also be beneficial. This way, nurses are able to ask any speech pathologists if questions arise. The sign stating, "I need help communicating," should be placed over the patient's bed. Although this sign comes in the resource package, it is up to the service provider to decide whether nurses or speech pathologists are responsible for placing these signs above the patient's bed. The purpose of this sign acts as a reminder to nurses that the patient has communication difficulties and the communication board should be used as a tool. We have purposefully chosen this neutral phase as not to introduce any negative connotations. We hope that this reminder system for nurses will be a useful strategy in implementing this resource effectively. Each package includes 2 evaluative questionnaires for the nurse to fill in. The evaluative questionnaire is part of the monitor knowledge use of the knowledge to action cycle, which will now be explained by Joanna.